Hi, everybody. Katie Harris here from the Mitochondria Code. So today we're talking about stem cells and why can't you just manipulate stem cells in the United States? Because, basically that's why people go abroad because they're taken in by the marketing message that there's some sort of proprietary method that they do in Guatemala or Costa Rica or Mexico or whatever the case may be. And so the question is, why does it seem so restrictive in the United States? Like, what is the problem here, and why can't we do what they're doing? Well, why can't you just grow your own cells in a lab and just put them in your own body, right? Well, there's some things that you can do, right? So PRP basically is taking blood out of the body. We spin it down, we separate the red blood cells from the platelets, and then we re-inject them into the body. This is considered minimal manipulation. And it's once you manipulate cells, that's where you come close to the legal line. Now, manipulating cells the way I just described for PRP is completely legal. We do that all the time. We do it in cosmetics. PRP is given in a lot of specialties. It's very common, but the thing is that process that I just described is very minimally manipulative. So, um, it's when you cross over into doing other things to the cells, altering them, that you start crossing that legal line. So the FDA classifies stem cell treatments based on how much you alter the cells. If you simply take your cells, filter them, or concentrate them, and then inject them back into your body the same day, that's also considered minimal manipulation, and you can absolutely do that. There's no problem with this. It's generally allowed under looser regulations. But if you culture those cells, right, you grow them, you expand them, or you alter their function, now you've crossed a line. That's more than minimal manipulation. And that's where the FDA sees that product as now a drug or biologic. Okay, so and that requires an investigational new drug application that gets very, very expensive. So if you need an IND, clinical trials, full FDA approval, just like any pharmaceutical agent. So you're creating something new. And that's where the pharmaceutical industry is interested, right? They want to do this. They're going to spend millions and millions of dollars because that would be something that you can patent. Remember, a medication is something that alters or blocks a system or something in the body. That's how things get patented. So it has to block or alter something. We believe in regenerative therapy that the body knows what to do. So minimal manipulation is right up our alley because that's exactly what we believe. The stem cells know what to do. We don't need to manipulate them. We don't need to improve them. We don't need to change them or alter them. They're fine just the way that they are, and that's how they function, and that's how they help people. So why is all of this so strict in the United States? And it's basically because of past problems, right? So a lot of clinics, when the stem cells really kind of first came out in the 2000s, clinics rushed out and they were using untested stem cells or importing them from China and Korea and all over the place. And a lot of injuries happened, right? There were a lot of serious injuries, including blindness, tumors, and infections. And it's always when stuff like that happens, when you have that Wild West mentality, that the governmental agencies step in and say, okay, wait, let's understand what's going on here. And is the FDA frustrating? Yes, of course. But it's there to serve as guidance and to help us to make sure that we don't have, all these issues and problems. Is the FDA perfect? No, not by any stretch of the imagination, but what they're doing in this case is absolutely reasonable, right? So ultimately, these laws are about protecting patients. And so when you change a cell's behavior, you introduce new risks, and those risks haven't been evaluated or fully understood. And that's a lot of what you get when you go down to these different clinics abroad. So again, Costa Rica, Mexico, Guatemala, wherever you're going, you are basically a guinea pig for that proprietary method because who knows, you don't know what they're doing. Because a lot of these places will say it's proprietary, that their methodology is proprietary. Well, if it's proprietary, that means they're doing something to the stem cell line, right? Because there is no proprietary method to getting stem cells and then giving them to somebody. There's absolutely very minimal to no manipulation of the stem cells. So there's no proprietary method. So what are they doing exactly that makes their process proprietary? They won't tell you. So that introduces the um, the element of just kind of shady science, right? If they're not going to tell us what they're doing, then we don't know what they're doing. There's no transparency. So they could be doing anything, and it's above and beyond the law. Okay. So then it comes down to how many people have complications or issues and how many of those get swept under the rug so people don't know. And all you see is marketing, and you see, the Parkinson's patients dancing around and like they've never had Parkinson's before. But you don't see, the patients that got cancers or got no relief whatsoever, or spent 30, $50,000 with no response whatsoever because who knows what they were given, right? And you don't see who's exploited as well. Like, where are they getting those stem cells from, right? What are they, I don't even want to surmise on where they could possibly be getting them from, but are they getting them from legal sources? Are they getting them from fair trade sources? Or are they just kind of exploiting groups of people to take them from them? You just don't know. Um, basically, there are laws about protecting the patients in the United States. This doesn't mean you can't do stem cells. You absolutely can do stem cells in the United States. There's federal law that says you have the right to experimental therapies that aren't FDA approved, right? So we do a lot of non-FDA approved therapies in the United States, and stem cells is one of them. You just cannot use aborted fetal tissue in the United States, and you cannot manipulate the cells, grow them, alter them, change their behavior. Those are things that you can't do unless you have some sort of clinical trial going on. So it's still possible. You just need a lot of money to create a clinical trial and create transparency around what it is that you're doing. And then we can test and see if it's really effective, as opposed to just throwing a marketing messaging and tugging at people's emotional heartstrings. So no, you can't just grow and inject stem cells in the United States without regulation. That's a no-no. But it's not a blocking innovation. It's about making sure the treatment is safe and effective before it reaches you. So again, what you can do is get donated perinatal tissue, which is what we do, especially at the Center for Regenerative Medicine, where Dr. AJ Farshian has been leading stem cell therapies for decades, right? He's treated some of the biggest names out there. He's worked in the Olympics. He has a center that curates these stem cells. They get the donated perinatal tissue from, people that have never had, women that haven't had COVID vaccines. And then they minimally manipulate that so they get the stem cells, they're able to harvest the stem cells, and then they're cryo-frozen. So they come to you very minimally touched, and they're just absolutely perfect the way that they are. So they're extremely high quality product. It's you're not going to get price gouged. Okay. We can talk to you about the pricing, but it's very affordable for really anybody, especially if you're suffering from chronic diseases and you're spending a lot of money on different medications and treatments and stuff that's not getting you anywhere. Then stem cells becomes an extremely affordable treatment. So it's something that we can talk to you about. We're happy to set up a consultation with you. If you want to come into Philadelphia, we can do Zoom calls, and we can do treatment plans with you based on what it is that you have going on. And again, stem cells are part of a bigger medical optimization plan. It's not, I'm going to do stem cells one time and then my life is going to be perfect from here on out. It's stem cells are part of a bigger treatment. You might need to do 3 injections of stem cells. You might need to do stem cells monthly for a while. You might need to do them quarterly. Maybe you do them every 6 months. But it is a lifestyle change where you incorporate stem cells into your health program based on what it is that you're doing. So they absolutely need to be affordable so that you can do this on a long-term basis. One and done never works, not even with stem cells, right? They're not at that point where a one and done is capable. So you need to think about and build out a medical optimization program that is right for you, that's right for your health condition. It may or may not involve stem cells. There's a lot of other options out there. There's exosomes, there's regenerative protein arrays. There's a lot of other things that we can talk about. And that's why you want to work with a provider that you can have access to, right? You don't have access to your clinic down in Panama after you're done because they they take your money, they do their proprietary method, and you're out the door again, and they're bringing in the next client because it's big money down there. So just something to think about. I'm not telling you not to get stem cells. We do stem cells. I've seen some amazing, I've seen amazing things happen from stem cells. You just want to give them to the right person for the right reason and using the right methods, right? And this is all possible in the United States. So feel free to book a consultation with us. The link is below, and I will see you in the next video.